Strabismus is misalignment of the eyes. Strabismus could mean that the eyes are crossing in, could mean that the eyes are wandering out, it could mean one eye is higher than the other eye. Many thyroid eye disease patients have strabismus. The way that they know they have strabismus is either they see it when they're looking at themselves that the eyes look misaligned, or they may notice it as double vision. But people may not notice it until the symptoms worsen. So when their double vision shows up, they may notice it for the first time, but they may have had signs of this beforehand. So the most common condition that we will see in an adult is thyroid eye disease. Many patients who have thyroid eye disease will have strabismus. Sometimes it's not noticeable to them, sometimes it doesn't bother them. Other times it's very noticeable or they're bothered by it. And being bothered by it could mean double vision. Glasses may or may not help with strabismus in adulthood. We can use prisms sometimes to take care of the symptoms that strabismus causes, but it doesn't necessarily eliminate the strabismus. Treating the underlying condition may help as well. Ultimately, surgery is our treatment option for strabismus. It's a permanent correction. There's always risks of redeveloping strabismus later on in life. It's about a 15% risk after having surgery for the first time that you may need surgery at some point again in your life. But the goal is to permanently correct the strabismus when you're operating. Patients that have strabismus can be bothered by multiple things. They can be bothered by the double vision it causes. Double vision is distracting. It bothers you. You're seeing two images most of the time. It's difficult to drive. It's difficult to do your daily tasks when you have it. It's very debilitating when patients have double vision, especially if it's constantly there. Double vision is by far the most bothersome part, and patients go around closing one eye or wearing a patch to get rid of that second image. Other things that they can feel, if their strabismus is caused by a restrictive process, for example, thyroid eye disease is a restrictive process. It pulls, your muscles become tighter and pull on your eye. Then you may feel discomfort when you move your eyes. You may get headaches. You may feel pain when you're trying to move your eyes in a certain direction, and that would manifest throughout the day. Strabismus is also bothersome cosmetically. It's hard for people who have strabismus to talk to other people and to feel like that person is looking them directly in the eyes. And so confidence is usually down when you have strabismus. It makes social situations a little awkward. And even if it's not that noticeable, the patient themselves are bothered by it. And then finally, strabismus may cause you to move your head in a certain position to get rid of double vision or to feel more comfortable. And so people will go through their day with their head turned to one side or with their chin up or chin down or tilted to get rid of that strabismus. So the lucky part about being at the University of Michigan is that we're surrounded by a research institution, and whenever anything comes up in medicine and ophthalmology, we're going to be the first ones doing it, we're going to be the first ones inventing it, we're going to be the first ones trying it, and we're able to offer that to our patients. Our thyroid eye disease program here is world-renowned. We have patients throughout the world coming to our thyroid eye disease program, mainly because we have doctors in every specialty focused on the patient here working together. So there's physicians in oculoplastics, neuro-ophthalmology, pediatric ophthalmology, adult strabismus. There are endocrinologists that are working on the patient and a multitude of other doctors that are involved in the care of the patient. It's very unique here at the University of Michigan, and we're able to offer that to patients. And patients love it because they don't have to go to multiple different doctor's appointments on different days. They can have their care centralized here, and we all talk to each other. We have a monthly thyroid meeting where we can discuss our complex patients and ask for suggestions or help as we're doing that. I think that's a very novel approach to taking care of strabismus and thyroid eye disease.